So this kind of brings us to a question that I want to answer over the next 5 to 10 minutes. And this is a question that is being posed by a number of people who have been watching these webinars. And it's really, I'm a senior with IBD. What is the risk of contracting COVID-19 if I leave my home? And I think they see the data from Canada and from the world showing that seniors are at the highest risk. They see the data from the Secure IBD Registry also showing that if you're over the age of 60 and you have inflammatory bowel disease, your risk is higher than if you're younger. And so this is a very important question, and not one just for the IBD community, but on a personal note, I was having this argument with my own mother last weekend, and we got into a bit of a fight as I was kind of telling her what I think she should and shouldn't do. And I just want to say that the advice I'm going to give to everyone else is really the same advice I give to my parents who don't have IBD but are still, they're over the age of 65. So when I'm going to try to answer this question, I just want to do a little bit of math and epidemiology and some data and some examples to explain to you what are the practices that are higher risk versus potentially lower risk. And I think one of the exciting things that has happened since we're now kind of 5 months out into this pandemic, since the first cases were reported in China, is that there's been a number of studies that have been done looking at how individuals have contracted the virus and how they've spread the virus. And that's giving us important clues to what are kind of high versus low risk practices as we go out into society. So I've shown this slide a number of times, and this is the R0, or the reproductive number, and this R value reflects the average number of cases an infected person will spread in a population. And so if that R0 is less than 1, if I'm sick and I infect less than 1 person, the disease will decline. If it equals 1, it means I infect one other person, that one other person infects another person, and we see that the disease will be stable over time. Where it becomes scary and challenging is when that R0 is greater than 1. It means that one person will spread the disease to more than one person. So if the value is 2, and for this coronavirus, it's ranging between 2 and 3, one person affects 2 people, each of those 2 people infect another 2 people, and you can see that that exponential spread increases. Now, I've talked about this before on previous webinars and how important it is for us to try to drive this R0 value under 1. But I want to introduce a new concept as well. It's called the dispersion factor, and we denote this not by the letter R, but by the letter K. And it describes how much of an infectious disease clusters. And what we've seen a lot with this virus, and this is also seen in other types of virus, is there are some scenarios where an activity, an event happens, and in that event, a number of people become infected. And we call that a cluster. And so a cluster is where 3, 4, 5, 10, 50 individuals become infected by the same activity. Sometimes it might be one person spreading it to a number of people in a certain environment or scenario. We sometimes call that person a super spreader. You may have heard that in the news. And when people or epidemiologists, infectious disease epidemiologists study this dispersion factor, they can actually look to see how likely will a virus like this coronavirus cause clusters. One of the reasons why it's important is that if you can identify these clusters, you can actually do a bit of detective work. You can actually look back and see, okay, how did these individuals get this virus in these clusters? What were they doing? What were the behaviors and the practices that we're doing? Because if you can figure that out, you can then turn around and say, well, this is a high-risk practice versus a low-risk practice. And now that we're 5 months out, we've actually been a number of studies that have looked at clusters and tried to ask, what were people doing in these clusters to get sick? And I just want to share 3 different examples that I think are very informative that tells us a little bit about risk practice. So this is a study that was done in China at the epicenter between January 4th and February 11th, where these physicians identified 318 clusters of 3 or more cases. So it means that a cluster had at least 3 people who were connected to each other to an event, and they all were contracted COVID. And you can see that the majority of the people from these clusters, the majority of these clusters occurred from home exposure. So there was a family that was living in an apartment or in a home. Somebody from the outside came in, they were sick, and they spread it to other family members. And that makes sense because family members are going to be in close contact. But if you now kind of separate the families out and ask, how did the individual who came into the family get sick? you can start to see that there are a number of things that happen that increase the risk of forming clusters. A third of the clusters that they reported happened from transportation. This was from being on a plane, going on a train, or doing public transportation. About 4% occurred from a restaurant or a food-related event. Another 2% of clusters occurred from an entertainment activity, such as attending a movie theater or a concert. 2% of the clusters occurred, and they traced it back to individuals who were shopping, either at a mall or a supermarket, having some kind of shopping activity. But what was really important is they only identified one cluster that originated from being outdoors. Well, what that meant is being outdoors is unlikely to have caused these clusters of infections. And not only this study, but many other studies now are starting to show that people who are going outside, the likelihood of getting infected and spreading to a lot of different people in that scenario is quite low. And so again, we're starting to see that being outside is actually a relatively safe practice. What about indoors? Well, we've actually seen a few examples that really kind of explore the impact of what happens indoors to spread this virus. And this one I suspect people probably saw in the news, but they actually have done a very detailed epidemiological analysis published out of the CDC's journal just recently. And it looked at a church choir practice that happened in March of 2020. And there's a choir that has 122 choir members, and on March 3rd, 78 of them attended a practice. And then on March 7th, one of those individuals developed symptoms. Now, there's an incubation period that can go up to 5 days, so it may be possible that that individual was potentially infectious on March 3rd, but the major activity that happened was on March 10th. Another 61 attended a choir practice when this individual started to have some symptoms. And out of those 61 individuals, 53 of them went on to develop symptoms that were suspicious for COVID-19. 33 of them tested positive and were confirmed, and 20 were considered probable cases but weren't tested to confirm their cases. 3 ended up in hospital, and 2 actually passed away from this event. And when you look at what they were doing to potentially spread the virus amongst each other, well, you can just imagine a church choir practicing. They're sitting close together. Some of them shared snacks. At the end of the practice, they stacked chairs and they interacted with each other. And of course, they were also singing. And what we discovered is sneezing passes this virus the farthest and the fastest, followed by coughing, but even very loud speaking and singing can actually transmit the virus in people that are close to you. And again, some of these things have led to the recommendations of wearing masks that we hear in society. So I want to bring in one last example, and this is an example coming from a workplace environment. And this was, again, another epidemiological analysis published in the CDC's medical journal. And it looks at an office tower in South Korea. And between February 21st and March 8th, they identified a few clusters coming from this building. So the officials from South Korea identified every single person who lived, worked, or visited this building. There were 922 employees, 201 residents, and 20 visitors. And they tested all of them and did contact tracing interviews with them, of which 97 or 8.5% of the total kind of occupancy of that building during that month period tested positive for COVID-19. So again, is a large number, but if you actually look at where most of these 97 people came, they actually came predominantly from the 11th floor. And the 11th floor of this office building was a call center that had 216 employees that worked in this call center. And what you can see here is a map of what this 11th floor looked like. And you can see the blue chairs here are people in the call center who eventually tested positive. And again, like I said, 94 of these 97 all came from this 11th floor. And again, now the question is, what were they doing to cause them to be infected? I mean, obviously, they were talking, sitting close together, but there's only one bathroom, a men's and women's bathroom, that they would have come and shared. They had elevators that they would have shared. They would have went up and down these stairs. There's some places where they could have eaten together. So what were they doing to ultimately put themselves at risk? Well, the answer to that is if you reveal the other side of the floor. So this is the other half of the 11th floor. And you can see here very few people who worked in the call center on this side of the floor, even though they would have used the same bathrooms, they would have walked in up and down the same stairs. Very few of them actually got infected. And what this is really kind of showing us is that close proximity, being close to people, talking, if somebody's sneezing or coughing, being there for a long period of time, they would have worked together for hours in these types of environments, are the primary things that are happening to put people at risk for developing this transmission of the virus. So when I think about risk of transmission, kind of going back to answering the question, there's a lot of different things you can do that have different gradients of risk. So obviously, if you shelter in home with you and your family and nobody enters your house, your risk of transmitting the disease is essentially zero. But we can see from a number of different studies that going outside is actually a very low risk practice. You can go out, you can spend time with your family. Now, if you start doing activities with other families or with other people, you do start to increase your risk, even outdoors. But again, the risk is very small. And if you're practicing good physical distancing, the likelihood of you being infected, if you're walking outdoors, if I go for a walk with my mom, for example, and I give her space, the risk of me getting COVID from her, or more importantly, her getting it from me, is very, very low. Once you start going indoors, again, the risk starts to increase. But the difference between now and months ago is that we have knowledge. We know that we can keep people 2 meters apart. We know that we can wear masks. There are things that we can do to minimize the risk. The highest risk are scenarios where you might find yourself where it is difficult, if not impossible, to be in a situation where you can't be apart from people within 2 meters. And even depending on your situations, again, there's a number of things that you can do. The key thing is maintaining that 2 meter barrier. Wearing a mask is critical to protect yourself and protecting you if you happen to have symptoms from transmitting the virus to others. Definitely you want to wear that mask if you are within 2 meters of individuals. Wash your hands, that's key, so that if you are potentially did get exposed to something, you've touched something, you've washed it off. The fewer people you interact with, the less likely you're going to have risk. You want to keep those interactions short if you do have to be within 2 meters of somebody. And again, common sense things of avoiding sharing food and other things. So the things that we can do to protect yourself. And a lot of the data and the science is really supporting these recommendations that we have for you.